What is easily overlooked is many people have high blood pressure but do not know it. Because this condition often does not cause obvious pain, you can still live normally. But the pressure in your blood vessels may have been elevated for a long time. After age 60, do not just rely on how you feel. Check your blood pressure properly and pay attention to habits that can make blood pressure harder to control. Many people after age 60 think that high blood pressure must immediately alert the body red face, headache, palpitation, and a fast heartbeat. But high blood pressure does not always have clear signs. You may still feel normal, still walk around, eat, and talk like every other day. The problem is that if you do not measure it, you will not know where your numbers are. And when high blood pressure is prolonged, the risk of cardiovascular and kidney complications, as well as stroke, can increase. This channel exists to help you understand the body with the clearest facts, not with dry medical terms. Subscribe to the channel now to receive practical health guides, helping you maintain an independent life in your golden years. And watch until the end of this video, because you will know exactly 4 signs that can warn of extremely high blood pressure or complications that the body sends, but are often mistaken for old age diseases. Why feeling completely normal is the exact point that easily makes many people complacent. How scary is this silence? Let me tell you about a man with a history of high blood pressure at the age of 68. A few months ago, a buzzing sound and blurred vision did not prove high blood pressure by themselves. But at the age of 60 or 70, such repeated signs should not be taken lightly until one morning, his hand holding the scissors dropped. One side of his face showed signs of weakness, and it was harder to speak. In the emergency room, his blood pressure was 190 over 110. That buzzing sound was not an old age disease. It was a sign that should not be taken lightly. Why didn't the patient feel pain beforehand? Let me use this image for you to easily visualize. Imagine your blood vessel system is like a soft water hose used for watering plants. Blood pressure is exactly the pressure of the water flow. When at a normal level, the water flows smoothly, nourishing the heart, brain, and kidneys. But when blood pressure rises high, it is like someone turning the faucet to the maximum level. The pressure beating against the wall of the hose is extremely strong. The problem is, this blood vessel water hose does not have any pain-sensing nerves on its inner surface. Therefore, the blood vessel walls can be gradually damaged, lose elasticity, and increase the risk of complications, weakening day by day without you even knowing it. The body does not alarm with direct pain. It signals through indirect cracks in other organs. If you do not monitor your blood pressure and do not pay attention to unusual symptoms, the risk of complications can increase over time. Sin 1, unusually severe headache or a heavy feeling behind the neck. You wake up with an aching feeling behind your neck. Your first reaction is to massage your neck and shoulders and tell yourself, I must have slept on a pillow that was too high last night. Or I'm getting old, so my bones and joints often ache. But here is what many people easily overlook. The more worrisome thing does not lie in the pain, but in that very complacency. If you feel an unusual heaviness, a throbbing heartbeat, an abnormal feeling of heaviness and tightness behind your neck, or like an iron band tightening around your skull, then that is absolutely not normal muscle pain. That is a sign that needs attention from deep within your blood vessel system. Let me explain thoroughly so you can understand what is really happening inside the body at that moment. In medicine, we call high blood pressure a condition that often progresses silently because for many years, it hardly shows any symptoms. Our blood vessels have a very resilient endurance. However, when blood pressure suddenly spikes to a red alert level, usually when the systolic reading crosses the 180 mark. This number deserves attention. Imagine the skull as a closed space protecting the brain. Inside is a system of blood vessels continuously delivering oxygen and nutrients to the brain. When blood pressure rises high, the pressure in the vascular system also increases. In some people, this can be associated with severe headaches, tightness in the head, heaviness behind the neck, dizziness, or unusual discomfort. The back of our head and neck is an area where many important nerve roots are concentrated. That is why when the blood vessels are tense, you will clearly feel a heavy pressure, severe pain, accompanied by dizziness, concentrated right in this location. However, I need you to remember this: not every headache is caused by high blood pressure. Headaches can come from lack of sleep, muscle tension, stress, sinusitis, cervical spine problems, and side effects of medications, or many other causes. But if you are an older adult and the pain appears suddenly, severely, persistently, completely different from usual, or is accompanied by blurred vision, difficulty speaking, weakness in the limbs, chest pain, or shortness of breath, then you should not wait. Pay attention and monitor. Therefore, instead of guessing blindly or superficially massaging your neck, pay attention and monitor your numbers right at home when an unusual headache appears. Do not hesitate and think I'll wait a bit to see if it gets better. When a heavy head strikes, the first thing to do is to take out the blood pressure monitor, sit down on a chair, lean back comfortably. Calm your mind for 3 to 5 minutes, and then press measure. Do not try to lie down hoping sleep will solve the problem. Going to sleep when your blood pressure is spiking is like seeing the empty gas warning light, but still closing your eyes and stepping on the gas pedal. Measuring your blood pressure takes less than 1 minute, but it is the most solid protective barrier. It warns you in advance whether you need to rest, take medication, or immediately go to the emergency room. Do not just rely on subjective feelings for those vague sensations. Take action and let the numbers tell you the truth. Sin 2, blurred vision, smudged vision, or sudden changes in vision. Let me tell you about a 72-year-old woman. She had a habit of sitting in her familiar armchair every evening to knit a sweater for her grandchild. But one evening, she suddenly saw the knitting stitches in front of her eyes become noticeably blurry. The streaks of color smudged together. More notably, occasionally in the corner of her eyes, there appeared sparkling flashes of light darting past, exactly like a camera flash. A dangerous complacency, her reaction. She took off her reading glasses, wiped them very carefully, put in a few drops of artificial tears, and clicked her tongue, probably because I looked for too long, so my eyes are tired. At this age, having blurred eyes is just a normal thing. She closed her eyes to rest, certain that tomorrow morning everything would be clear again. She blamed old age, blamed the scratched glasses, but she did not know at all that blurriness had nothing to do with normal presbyopia. But it was a sign that needed to be checked early, sent from deep inside her body. But the right thing to understand is that blurriness is not presbyopia due to age. It is a sign that should not be taken lightly from the smallest blood vessels in the body. What is happening inside, hidden behind the retina, is a fragile microvascular network with walls thinner than a single hair. When blood pressure spikes, the blood flow is forced through these ultra-small capillaries with a higher pressure than normal. It is exactly like you using a high-pressure nozzle to pump directly into a very thin balloon. When high blood pressure is prolonged or rises very high, the small blood vessels in the retina can be affected, causing vision changes and needing to be checked by a doctor. The flashes of light or the cloudiness that you see are the very reflections of the damage occurring in the eyes taking place inside the eyeball. The hidden risk to your brain and independence. If you ignore it, the price to pay is not just temporary blurred vision or a new pair of reading glasses. It is irreversible damage, leading to severe impacts on your vision if not properly checked and treated. And a more haunting truth, the eyes are a mirror directly reflecting the brain's blood vessel system. If the small blood vessels in the eyes are showing signs of damage, what guarantees that the blood vessels inside your brain are still safe? Worse still, if the blurred vision occurs suddenly and is accompanied by signs of weakness in one arm, a drooping mouth, or you suddenly have difficulty speaking, please do not hesitate. That is no longer a story of the eyes, but an alarm bell showing that the brain's blood vessel system is in danger. Think about what your vision means for your daily independence. It is not just about knitting a sweater. It is about seeing your family smile, navigating your home safely, and keeping your high quality of life. When hypertensive retinopathy, the medical term for this blood vessel damage, begins, it acts like a silent thief. Routine blood pressure monitoring at home is your first solid line of defense. By catching those elevated numbers early, you can protect those delicate capillaries before they burst or leak fluid. Remember, your body is an interconnected system. Protecting your heart directly protects your precious sight. Therefore, if you notice any changes in your vision, do not self-diagnose or arbitrarily use eye drops. Mention this issue immediately to your ophthalmologist or your family doctor at your next visit. Tell your doctor in detail about those flashes of light and that blurriness. Timely medical discussion is an important step to halt the damage. Do not let a small complacency affect your vision in your golden years. Sin 3, shortness of breath, chest tightness, and an irregular heartbeat. When turning 60 or 70, we easily accept the body getting weaker. You assume that panting after climbing a few stairs or carrying groceries is a natural part of aging. But this is when things need to be taken seriously. There is a boundary that needs to be clearly distinguished between natural aging and cardiovascular signs that need checking, which we often overlook. If you are folding clothes or sweeping the floor and suddenly feel your chest getting heavy, your heart pounds and your breathing is so interrupted that you have to sit down, please do not click your tongue and blame it on a lack of exercise. It should not be hastily considered as normal fatigue. It is a warning whistle to be careful, showing that blood pressure might be forcing the heart to work harder than usual. Why does this phenomenon happen? Why are you just doing a very light task but panting as if you just went jogging? Let me thoroughly explain this mechanism for you to understand. Imagine your heart is like the main water pump of the whole house, and the blood vessel system is the water pipe network, the ideal state. When your blood pressure is at an ideal level, these pipes are very soft and elastic. The heart pump only needs to operate at a gentle, leisurely pace to push oxygen-filled blood to nourish every organ, from the top of the head down to the toes. The danger of high blood pressure, however, when high blood pressure appears, the body can endure extra pressure. Under prolonged pressure from day to day, month to month, these blood vessel pipes start to get damaged. They become hardened, narrowed, and lose their natural elasticity. It is exactly like water pipes getting clogged with thick rust scale inside. At this time, to push the vital amount of blood through a space that is both narrow and rigid, what is the heart pump forced to do? It has to strain itself. The heart must contract harder to pump blood, increasing the compression force much more than compared to the normal level. And, if any machine has to operate overloaded continuously, there will come a time when it falls apart. With the heart, when having to bear this prolonged or excessive pressure, the heart muscle walls will begin to thicken, hypertrophy, and gradually weaken because they are not supplied with enough oxygen. This lack of oxygen creates a dangerous condition known as ischemia. When your heart muscle starves for oxygen while desperately trying to pump against high vascular resistance, it sends out a critical distress signal. That signal translates directly into the squeezing, painful sensation, warning you that the muscle is failing, the feeling of a heavy chest, a choking chest pain, or your interrupted breathing is not normal fatigue. That is exactly the sign showing that the cardiovascular system needs to be checked early. When to take immediate action. This is the time you must completely put aside the mentality. Resting a bit will be fine, or I don't want to bother my children and grandchildren. You should not wait to see if it gets better tomorrow. The American Heart Association, AHA, draws a very clear boundary. If your blood pressure crosses the threshold of 180 over 120 millimeter G, accompanied by chest tightness and shortness of breath, you are experiencing a hypertensive crisis, seek medical help right away. Call emergency services 911 immediately. Absolutely do not drive yourself to the hospital. And do not try to take more medicine to force your blood pressure down. The only thing to do is sit still and call emergency. In this moment, a few minutes of hesitation out of fear of being a bother can delay the time for timely treatment. Sign for weakness in the limbs: drooping mouth, difficulty speaking, sudden loss of balance. We come to the final sign, and also the sign that needs to be handled the fastest. Uncontrolled high blood pressure is exactly one of the leading important risk factors for stroke. One morning, you intend to pick up a glass of water to drink. Suddenly, your arm becomes noticeably weak, the glass slips out of your hand and falls to the ground. You stagger, losing your balance. At the same time, one side of the face goes numb, one side of the face is weak or droops down. You panic and want to call your family members, but have difficulty speaking. The words are unclear. At this moment, the biggest mistake of many older adults is out of fear or hesitation to bother their children and grandchildren. They quietly go to lie down and rest, hoping they will recover when they wake up. But the truth is that sleep can make them delay the time for treatment and increase the risk of severe complications. But I want you to deeply understand this. Changing your mindset in that moment will help you have the chance to be treated promptly. Dropping the glass of water is not due to clumsiness. A tied tongue should not be hastily considered as old age confusion. Do not be embarrassed or hastily hide it from your children and grandchildren. Please deeply engrave this in your mind. These manifestations are not a weakness of the body. This is information. That is how the body is sending an urgent signal, needing attention that the brain might be experiencing a reduction or interruption in its nourishing blood flow. Many patients have shed tears of regret because they silently endured, thinking that their body was betraying them. But no, numbness or a drooping mouth are the most precious signals for help. You must cherish that information, not deny it. Your body is your most loyal partner. And in this critical moment, it is screaming for your cooperation. It is not an enemy to be ignored. It is a system calling for support. When you feel that sudden loss of coordination or clarity, realize that the biological clock is ticking, and your prompt reaction is the only way to safeguard your future. When suspecting a stroke, the thing to do is call emergency immediately. Do not wait to see if it gets better on its own. In medicine, treatment time is very important. The sooner the patient is brought to the hospital, the more opportunities doctors have to evaluate and intervene appropriately. Therefore, if signs such as a drooping mouth, weakness in one side of the limbs, difficulty speaking, sudden blurred vision, or an unusually severe headache appear, call emergency immediately. Do not drive yourself. Do not take medication on your own. And do not wait until the next morning. Think about your life beyond this moment. You have decades of memories, wisdom, and stories yet to be shared with those you love. A stroke does not have to be the end of your story, but it does require you to act with absolute urgency. Every second that passes without medical intervention is a second where brain cells may be permanently lost. By choosing to call for professional help, you are not being a burden. You are taking responsibility for your own well-being and ensuring that you remain present for your loved ones. Do not let pride or fear steal your independence. Your health is the foundation upon which your golden years are built, and defending it is the highest form of self-respect. Absolutely do not hesitate or fear bothering others. Calling an ambulance instantly is an important step to receive treatment at the right time. The decisiveness in those few minutes will be the boundary deciding whether you can retain your autonomy, continue to walk, talk, and live proudly and independently in the following years. Or not. What I want you to take away after this video is not anxiety, but a very simple habit. Do not just rely on feelings. Check your blood pressure numbers. High blood pressure can progress silently over a long period. You can still eat, walk, and converse normally, but your heart, brain, kidneys, eyes, and vascular system might be bearing extra pressure. Therefore, if you or your loved ones at the age of 60 or 70 experience signs such as an unusually severe headache, heaviness behind the neck, sudden blurred vision, shortness of breath, chest tightness, an irregular heartbeat, weakness in one side of the limbs, one side of the face drooping, difficulty speaking, or loss of balance, do not hastily consider it just old age. The first thing to do is stay calm. Sit and rest. Measure your blood pressure properly and record the numbers and accompanying symptoms. If the numbers are very high, especially around 180 over 120 millimeters G or higher, or if there is chest pain, shortness of breath, weakness or numbness on one side of the body, vision changes, confusion, or difficulty speaking, call local emergency services to get timely support. But if the signs are milder but repeated, proactively discuss them with your doctor at your next visit. Early detection, regular monitoring, and using medication as directed can help reduce the risk of complications while preserving your ability to live independently. If this video is helpful, please subscribe to the channel and share it with your loved ones. The content is for reference only and does not replace medical diagnosis or treatment. This video is solely for providing information and sharing knowledge. The content does not substitute for medical diagnosis, treatment, or medical advice from a doctor. Viewers should consult a medical professional before applying any methods mentioned